Hi, I'm Pam Grove, Doctor of Physical Therapy. We want to continue on our lessons on core stability and pelvic mobility. So for those patients or out there, those people out there who are struggling with spinal problems, low back issues, or maybe pelvic dysfunctions, having difficulty controlling when they have to go to the bathroom, things of that sort, we want to get those transverse deep core muscles deep down that sit in our pelvis and those muscles, those sphincter muscles down lower that help us control when I go to the bathroom, as well as those low back multifida muscles to be able to work together when we want them to contract and when we want them to relax. So I'm going to go over the pelvic clock. Once you pretend you got a clock on your belly, when you got a clock on your belly, the 12 is upward, right? And the 6 is lower, 3 and 9 across. Well, pretend it also, if it was a bowl, the bowl can rock, right? Side to side can spin. So when I go into my 12, my pelvis is going upward, but my back is flattening out. So I want to learn how to get that mobility. The more mobility I have in my pelvis, the ability to contract those muscles on time when I want them to and hold them as long as I want them to, I'm going to get more stability. I'll see you on the next slides. So for any back problem, you have to develop core stability. And the best way to do that is with the pelvic clock. So you're going to pretend there's a clock on your pelvis here. So when I say 12, Jackie's going to go that way. So 12 is going to be going up. 6 will be going down. Now it's good to try to hold this for about 20 seconds each direction. The 3 and the 9 shift to the sides. Very nice, Jackie. And now if she's good enough, I'll have her do all the numbers, and she'll do the circular clockwise. And then she'll do the counterclockwise the other way. There you go. Okay? And then you develop core stability. You also want to develop more pelvic floor activation. And the best way to do that is with the Kegel. So we're going to use the pelvic clock 12 to get the TA activation with the Kegel. So what is the Kegel? The Kegel is when you squeeze inside to keep yourself from going to the bathroom on yourself. We all can do that. We're trying to keep from actually going to the bathroom myself. So I'm going to have Jackie do the 12. She's going to squeeze to do her Kegels. And she's going to hold both the 12, pelvic clock 12, and the Kegels for 20 seconds. And that's going to give you more core and pelvic floor stability. Very nice.